And speaking of which, I'm going to let Dr. Bill introduce more about himself, of what he does for his profession. So I'm going to turn the time to Dr. Bill and let you talk a little bit more about yourself that way.
Well, thank you, Brad. Appreciate that. Well, I want to echo a little bit of what you started to say, Brad. I really do enjoy what I do for a living. I'm really blessed. I'll kind of share a little bit of introduction of what I do here in a minute.
I'm
But
honored you called me Brad.
oh,
'Cause
geez, what am I doing?
I-
Brad is his better looking younger
yeah,
brother.
yes,
Just kidding.
yes.
Is that right, David?
That's
Younger,
right.
right?
That's right.
Slightly, actually, you're a little better looking, David. We'll give that to you. Just kidding. All right, he's right. I know I've known Brad for several years. How we met was an interesting story. But I have known Brad for a while. I've known his wife, and that's a good place to start this story because when Brad asked me if I had an interest in joining the JIFU team, we had known each other for several years. He knew I was a stem cell regenerative medicine specialist. He knew a lot of what I do, and he had done some treatments with me himself. But I will tell you that the best part of my job, and I will tell you a little bit about my background here, but I'm going to jump to the chase. The best part of my job is meeting people and relationships and getting to know people from all over the world or in this country from all walks of life. And I think as you age and get older, like I am in my mid 50s, you start to even appreciate those things more. I've always loved that. I've always been an explorer and an adventurer all my life. And I love meeting people. Everybody has an interesting story to tell. And that's one of the best things about me joining the JIFU team. I'll be quite honest, it's for selfish reasons. I love teaching. I love explaining things that if I do have a knowledge, I like to share that. I like to teach. But it's more of a vehicle for me to meet all you interesting people out there. And I will tell you that I'm extremely impressed by the corporate leaders and the head sales guys, your affiliates that are leading and teaching and coaching and the life coaching. I get just as much out of all that stuff as everybody else does. We all can learn from it. We all have stories to share. And when we get to make these interesting connections around the world, it just enriches everybody. That's really the spice of life, in my opinion. All right, enough of that. Now so I am very grateful to be a part of your team, and I couldn't be more excited to know all the corporate leaders too, because they are exciting, fun, and interesting people, and they like elevating and helping other people too. You know, we're all in this together. And I think once you become a JIFU team member, it really does flourish like a family, you know? You got the parents, and then they have the children and the grandchildren and the great grandchildren. So it's all one big happy family. And if you embrace it that way, and I think most of you do already, then, you know, they always said, you never work a day in your life if you do what you love, right? You find out what you love and then you never actually work. Well, I love my work and I would do it even if I didn't make money doing it. So, now, let me give you a little bit of my background. Some of you do know my background already, and but I'll hit the highlights. Well, I before I did this type of work, I was very into emergency medicine. So I always had an interest in sports medicine and emergency medicine, really. And for a while there, I'm really into sports and athletics, nutrition, fitness. I'm very passionate about that. And I'm sorry, I'm going to slow down. I just realized that we have the translator, and I apologize, Serena. I'm going to slow down. I'm a very fast talker because I got a lot of stories to tell, and sometimes I go a little
She
fast.
she said you're doing perfectly.
All right, I will slow it down though. I just saw Serena translating, and I just want to make sure I'm not going too fast. All right, so when I was, growing up, I was really passionate about sports, and then I had bad knees. So I had a lot of knee injuries and a lot of knee surgeries at a very young age. And I would have been very happy to be a professional athlete. If you asked me what sport could you do or what could you do for a living, what would be your dream job? It would definitely be professional athlete because I love sports. Okay. Now, it wasn't in my cards. God works in mysterious ways. There's always a plan for everybody. So that wasn't in my cards. But I've always been really into sports, fitness, and nutrition. My life revolves around those types of things. And when it was time for me to pick a specialty for medicine, it was either going to be orthopedic, sports medicine, or emergency medicine. I was really intrigued by emergency medicine because it treats, all the different ages. And I thought, well, if you get stranded on a desert island somewhere, if you only could have one job, if there was an apocalypse, and what is the most important job in the universe? And in my mind, I'm thinking, well, it would be very helpful to have a doctor to keep people alive. And then I thought, well, what kind of doctor, right? Do I become an ophthalmologist? Do I become an orthopedist? Do I become a heart doctor? And then if you're stuck on a stranded island or it's an apocalypse, you want an emergency room doctor because they can take care of any emergencies, right? They know a lot about everything. So that's why I chose emergency medicine. Exciting. I'm kind of a thrill seeker. I'm an adrenaline junkie. I love extreme sports, do a lot of them. And so I went into emergency medicine. But then anything I do, I want to be the best I possibly can be. And so I did a lot more training than just emergency medicine. I subspecialized in emergency medicine. What does that mean? Well, I did a critical care toxicology fellowship. So after I completed 4 years of emergency medicine, I did 2 years of a toxicology fellowship. Toxicologists are experts in poisonings, overdoses, drug interactions, even if you have radiation exposure, things like that. Anything entering the body can either be possibly a treatment or a toxin or a poison, depending on the dose and how you use it. Even water can be dangerous for you if you take too much of it, right? So that's kind of what a toxicologist does. And I did take care of a lot of overdoses, when people take multiple drugs when they try to commit suicide, or if it's just an accidental, overdose from some drugs they're taking recreationally. So then I did some trauma training after that. And then I did some wilderness medicine training. So I was a specialist in emergency medicine, and then my toxicology fellowship was a critical care-based toxicology fellowship. So I had pretty much the expertise of the expertise when it comes to emergency stuff. 7 years of postgraduate residency and fellowship training. And I loved it. I was immersed in it, and I traveled and worked in some of the busiest, best institutions in the country. And I thought I would do that forever. But then I learned about stem cells, and I was really just looking for a solution for my own needs. I was looking for an opportunity. I didn't want a knee replacement, and I love to ski, and I like to play a lot of different sports where I knew that I wouldn't be able to do that with a knee replacement. So once I learned about how stem cells work for the knees, then I was thinking, well, why don't more doctors know about how well this works, and why don't they tell patients about it? And why don't more patients know about it, right? It was a new field when I got into it about 2010. So once I learned about how well it worked, I decided I want to learn how to do this myself and bring this to other patients. I want to become the expert in stem cells. And I got in really early. I saw the writing on the wall that this was going to revolutionize medicine in general. We can treat so many different things. But initially, I was just treating orthopedics. But now I can treat a lot of different things. It's really become a wonderful tool to treat many, many different diseases, as well as just aging effects, like treating the hair, treating men for erectile dysfunction. Women can get better pleasurable experiences. We can even do some medical aesthetics with it. So now we do IV stem cells to just treat all sorts of diseases. And now I can help people with like stroke victims, traumatic brain injury, heart conditions, lung conditions, liver conditions, kidney conditions. Everything in the body is made up of stem cells. So now I've become a very successful stem cell doctor. I don't do any emergency medicine. I do very little toxicology now. I use toxicology as it applies to the things that I do now. And I can use some of those experiences in critical care and toxicology and apply it to even these healthcare products that we're doing now. And I can apply my knowledge base to really dive in deep into the details of the ingredients, how they work, are they effective or do they not work? If you want to know whether a medication is actually working, the mechanism of action, and whether it's effective, it's a toxicologist who's going to offer you that expertise or tell you whether something's actually working. So I do use my toxicology background to some degree now because I use that experience in critical care and toxicology when I'm diving into the ingredients or how things work and how they affect the body. And I like to weed through all the BS. Is there a translation for BS in Thai? In Thai, there probably is. But I like to weed through the BS because I won't tell you things that might work a little bit, that are good, that are all right, that sound good. No, if I only want to bring the most impactful things to my clinic and my practice. And when I'm endorsing a product, I'm not going to tell you about fluff and things that aren't so important. I'm going to get right to the nitty gritty and tell you why something is good and what you should focus on. So that's what I'm going to try to do now. All right. So that was a little introduction to who I am. I'm still very passionate about sports. I love fitness, nutrition, and I love the JIFU products. Just to give you a little bit more, tell you a little bit more about myself. I have 3 children. I started late in life. And so I got married when I was about 40. I have 3 children aged 11, 12, and one just turned 14. Okay. And unfortunately, I am going through a very difficult divorce right now. So life has been difficult this past year, but life goes on. All right. So that's enough about me and my background. Let's dive right in. Let's start with the Live product, okay? I'm assuming you just want me to keep talking. I guess we'll have a question and answer session at the end. Does that sound good for everybody? All right, I'm gonna go with that.
That's right. Yes.
All right, so I'm gonna dive right in now, and let's talk about the Live product first, okay? So what is in Live and what makes it so special? What are the key ingredients that we should focus on and be grateful that we have in that product? Well, resveratrol and glutathione. Those are the 2 things you need to think about. Those are the key ingredients of the Live product, and those are the ones that are doing the lion's share of work. So I'm going to talk to you a little bit about those two things. And I will tell you, there's a lot more than just glutathione and resveratrol. There's also a lot of different fruits and vitamins and minerals. All of these things can be really good for you. Very nice to take on a daily basis. Okay. So resveratrol, what is resveratrol? Well, resveratrol is found in grape skin, and you've probably heard that the French get credit for having low incidence of heart disease and heart attacks. Well, a lot of that is attributed to the wine that they drink, and they do like to drink their wine in France. Now, if you drink 1 or 2 drinks a day, it's actually cardioprotective. It makes it less likely that you will die from a heart attack. It does thin the blood a little bit, and that can be helpful. Well, the active ingredient in the wine is actually in the grape. In the grape skin is resveratrol. It activates something called SIRT1. And what does resveratrol do? Well, resveratrol has a couple different key properties. I'm going to tell you about the most important one. The most important one is that it basically makes the ends of telomeres are the ends of chromosomes, okay, that make up the structure of the human body. And when telomeres shorten as you age, that's when you see the signs and the effects of aging. When telomeres shorten, your skin becomes more brittle, you get wrinkles, arteries and vessels aren't as supple and responsive. Organs and other things also deteriorate as the telomere shortens. So the resveratrol lengthens the telomeres and just prolongs aging. So it's a very powerful anti-aging tool. It'll affect how you look and feel, but more importantly, or as importantly, it will help you live longer. I was just talking to my kids the other day, and my daughter was wearing, I can't remember what she was wearing, but it looked pretty good, but it wasn't so comfortable. And we were going out to do something. She's only 11 years old. And she said, "Is it better to look good?" She goes, "Well, I like these pants, but they're just a little uncomfortable." And I said, I better not give this reference. It's a joke, or it's a skit from Saturday Night Live from the 70s. So very few people will get this reference, but I'm going to throw it out there anyways. Okay. That's just the way I am. Fernando says, "It's always better to look good than to feel good." Take that to the bank. Better to look good than to feel good. That's what Fernando always says. You'll have to look that up. Saturday Night Live, Billy Crystal, 1970s. Okay. But I do tell people it's important to look good too, right? We want to feel good, but we want to look good. And just taking it one step further, when I was in Little League, we were playing baseball. And I know baseball is a very big sport in Asia as well. Um, well, when the shirts were untucked, the uniforms were untucked, my coach would always say, "Tuck in your uniform. You got to look like a champion if you're going to play like a champion." And that's kind of how life works. You can remember that. It's important to look good as well as feel good. So we'll get back to some of that later. Well, all right, so now we're back to the resveratrol. It upregulates, it lengthens the telomeres. When telomeres shorten and shorten, eventually, that's when you're going to die, when the telomeres shorten. So that's why resveratrol helps you stay alive longer, but it also can help with, the things that help you with beauty. All right. It also is an antioxidant. So what are antioxidants? Antioxidants are substances that protect your cells against free radicals. And what are free radicals? Well, free radicals are molecules that are produced when your body breaks down food or when you're exposed to tobacco smoke and radiation. They're not good for you. So resveratrol does work as an antioxidant. That's going to be a word you hear over and over again a few different times. A lot of fruits, for example. This resveratrol has fruits in it, a proprietary blend. A lot of that has antioxidant benefits. But when we're talking about vitamins and minerals, it's important for the body to stay tanked up on those things. Your body will work more effectively, fight off infection, works good for immunity when you have a rich, full tank of vitamins and minerals. It can lower blood pressure. It lowers blood fats. So when we're talking about cholesterol and the things that kill people, after the age of 40, the most common cause of death is heart attack or stroke. And so what you want to do is mitigate those types of diseases by doing something positive like lowering blood pressure, lowering cholesterol. It also, has been shown to lengthen the lifespan in different animals. It protects the brain, and it also increases insulin sensitivity. Insulin sensitivity is important to help the body regulate carbohydrates and calories so you don't gain fat. Okay, what are we going to talk about next? Well, some of the things it also can help with is joint pain. It's great for arthritis. It helps cartilage from breaking down. It suppresses cancer cells. So it's been shown to help with cancer. It can have hormonal effects too that can be positive. So all these different things are the different types of properties that resveratrol alone can bring. Now, Liv has two big ingredients I told you about. One was the resveratrol, the other one was the glutathione. So why is glutathione important? Well, glutathione is something that we use a lot of in my practice, and it has a lot of great anti-aging properties. Glutathione has antioxidant activity. It can prevent liver damage. And so when I was a toxicologist, I used to take care of a lot of acetaminophen poisonings. And acetaminophen is the same medicine as Tylenol in America. In Europe, they call it paracetamol. So I'm sure the Thai has a generic name for that as well. But when you take too much of that, it can cause liver damage. Well, the reason why people get liver damage when they take acetaminophen or overdose on acetaminophen is because their glutathione stores decrease, or they don't have enough glutathione to deal with it. Because if they did, then they wouldn't get the liver toxicity. So the glutathione is an extremely important ingredient to help protect the liver. And when people have acetaminophen poisoning, we actually give them injections of glutathione. It works at treating things like ulcerative colitis. It can treat autism. I happen to have two children who are autistic. My 12-year-old is very low functioning on the spectrum, and my 14-year-old is very high functioning. So I have both worlds, and I do treat my children in my clinic with glutathione. I also treat them with stem cells. Stem cells has been known to be very effective at helping the cognitive improvement of children with autism. And so I do have children that come into my clinic for autistic children for IV stem cells, and also come in for glutathione treatments. We do quite a bit of those in my clinic. So it's been used. Glutathione has also been shown to help with Parkinson's disease, and it just has a lot of very, very good anti-aging properties and protective properties for the body, especially against toxins. And you know, we use it a lot we use glutathione a lot in my toxicology practice. So that's kind of it for Resverat. That's kind of what I wanted to talk to you about Live. Like I said, there are some you know, fruit blends and other things that are part of resveratrol, part of the Live. 10 different types of fruits are present. And it's a very nice packet that's ready to go. So it's very easy to just pop one of those at any time. People should pack it when they go on, you know, excursions, day excursions, field trips. You know, it's just something that people should have around, and it's going to do a lot of good things to help you feel good right now. But more importantly, I think the key is that it's going to prevent the signs of aging. Should we just talk about the Live? If there's any questions right now before I move on to the Gen 3, or do you want me to keep going? What do you suggest?
Whatever you think. Simon liked how you were
Yeah,
to use
Simon,
your
what do you think?
expertise.
Do you think
Yeah.
people have a bunch of questions they want to ask me right now, or do they want me to just move right on to the Gen
I
3?
think you can just move on, because Simon say just move on. Just move on to Gen 3, and then from there we will take
All right.
questions.
I was
yeah.
really looking for an excuse to take a sip of coffee. So I wanted to ask you guys a question.
That's a
right.
good one.
All right, here we go. Right into the Gen 3. I love the Live, but I might even like the Gen 3 even better. Let's get into the Gen 3. So the Gen 3 is a collagen matrix you know, substance or package that you can drink. And what are we trying to improve, or what are we trying to accomplish with the Gen 3? Well, the most abundant protein in the body is collagen. And collagen makes up so many different things. It makes up hair, skin, nails, joints. Your blood vessels have collagen in them. It's really the most important thing that you can help supplement in your body that will affect so many different areas of your body. In addition to having collagen in the Gen 3 product, there's also things like biotin, niacin, and zinc that can help with skin and hair. We do a lot of those treatments. We do a lot of those types of blends in my clinic just to help with hair and skin. And it also has a bunch of different fruits and vitamins and minerals. And each one of these fruits, vitamins, and minerals have slightly different properties, but they're kind of similar in that many of them have antioxidant properties and other type of properties that can help you live longer, thin the blood. and also help you feel better, give you a little bit more vitality. Now getting back to the collagen, what's so important about the collagen and how much should you take? Well, they say that you want at least 12 grams of collagen per day. And the Gen 3 does contain over 12 grams. So JIFU did a very good job of finding a great blend of a collagen matrix at a great price that has all of the essential tools that we're looking for in a collagen matrix supplement. You know, whenever I'm trying to bring things to my clinic like peptides, we do different types of growth and healing hormones and things like that that can just help with vitality in my clinic. We're always looking for the strongest source. I always say go big or go home. We don't want to do, if something's worth doing a little, a lot of times it's good to do a lot. Now you do reach a certain point where you reach a point of diminishing returns, or it can actually be harmful if you take too much. But for a lot of things, the more the better. And in the case of collagen, you want at least 12 grams. But if you have more than that, is it helpful? Well, a little bit more is helpful, but you don't really need more than that. The studies have shown that once you get beyond a certain point, you reach the point of diminishing returns. So why are we taking it? Well, collagen can help with muscle mass. It can improve heart health. It helps with osteoarthritis pain. Let's not forget that arthritis is one of the biggest things that I treat in my stem cell regenerative practice. A lot of patients that have pain in their joints, not all the joints, but for many of the joints, it's arthritis that's causing the pain. And I would say, we all get arthritis as we age. It's like death and taxes. But we can do something about it. And arthritis doesn't always have to cause pain. Sometimes you can do something about it, like get stem cells injected and get rid of that. But if you take the collagen matrix, you're gonna be working to stop and slow the progression of a disease that we're all gonna get. And yes, at some point, even me, I think I'm a superhuman, can do it all, and I'm actually not in any pain, feel fantastic. I know that one day arthritis is going to slow me down too. So I want to do something about it now, and I've always done something about it. Because I told you knee injuries were my big problem growing up. By the time I was 17 years old, I'd had 7 knee surgeries between the 2 knees, and one was major reconstructive surgery at that time. And that was the end of my competitive sports career. I was really enjoying hockey and lacrosse mainly. But I knew that someday the arthritis in my knees, because you get arthritis more quickly and it becomes more pronounced when there's trauma to that area. So I knew someday arthritis would bother me, and I didn't want to ever stop playing sports. I didn't want to slow down. So I was always looking for what can we do to prevent arthritis or to treat arthritis. And then when I learned about stem cells, that's when I changed professions. I told you that story earlier. But I've also been taking things like glucosamine and chondroitin. Things like that can help collagen, or can help your cartilage, but to a minimal degree. There are some supplements you can take that can be helpful. But what is the most important thing you can take is a collagen matrix drink. So for sure, I'm taking this Gen 3 product, and I would encourage everybody to do it, because I'm very blessed. I don't actually suffer from pain from arthritis right now. Even though I have severe arthritis, I don't suffer from pain from it. A lot of people think when you're talking about the severity of arthritis, you're talking about the amount of pain you're in. And arthritis really isn't supposed to describe how much pain you're in. It's supposed to describe the condition of the cartilage. When it's very, very severely worn down, we call that severe arthritis. When it's only mildly worn down, we call it mild arthritis. But there are some people with mild arthritis and a lot of people with mild or moderate arthritis that have severe pain from that mild arthritis. And then the converse is true. You can have somebody with severe arthritis, but very mild pain from that severe arthritis. So the amount of arthritis people have does not correlate directly with the amount of pain that they're in. Why am I telling you this? Well, I'm telling you this for a few different reasons. Number one, no matter how far gone a joint is, or no matter how arthritic a joint is, it's never too late to put stem cells in it. We never know when stem cells are going to work and when they don't work, but they work greater than 90% of the time. So there's a very good chance it's going to work. And it doesn't matter how old you are or how severe your disease is, it's still likely to work. Now, if the cartilage is worn down less, that's just better overall, because my job when I put stem cells into a knee joint, for example, is to regrow some cartilage. And I don't have to regrow all the cartilage. I just need to regrow enough of it to turn the clock back to the point when it started bothering that patient. And sometimes that's 2 years worth of cartilage, and sometimes that's 20 years of cartilage. But usually I can achieve that goal. If you can support your cartilage in all your joints in your body, then maybe it'll never bother you in the first place and you never need to see me. So that's the goal of the Gen 3. I would say arthritis and treating joint pain is one of the number one biggest things that you as affiliates should focus on, because we're all getting it at some point. I mean, we all get it at early on, actually. It doesn't always bother you, but eventually it will, because when I'm 90, I will slow down, I'm sure. I hope to be doing all the same things I'm doing now, but we'll see. If I take the Gen 3, maybe that'll help. A lot of people are working out, trying to stay healthy. Well, just taking collagen will support that muscle mass and give you bigger, better muscles. Who doesn't want that, right? It helps with skin elasticity and hydration. We talked about feeling good. I talked about the arthritis. Now let's talk about the skin. You want to look good and feel good. And the two feed off each other, right? We talked about that earlier. And collagen can help with skin hydration and elasticity, especially when you age, okay? It can promote and helps with elastin. So what is elastin versus collagen? Well, collagen you can think of as the form and structure of the body. It helps prop everything up. It helps everything stay in the right place. And then the elastin helps with the elasticity of the skin, for example. It helps if everything was just strong and had good structure, it might not have the good movement. And you need that movement, you need that flexibility. That's where the elastin comes in. So elastin is a naturally occurring, stable protein, and it provides the resilience and elasticity to all the vital organs in the body. So we're talking about heart, lung, blood vessels. Elastin is very important for the blood vessels and the organs to operate effectively, just as important as the collagen is important. Collagen makes up 90% of the skin, and elastin makes up 10%. Okay, so that's kind of the collagen and elastin symbiosis, we'll call it. That's a difficult. Serena, if you know the translation for symbiosis, and you probably do, because I know they have that word in Thai also, but that's a fancy scientific word there. Just had to throw that out there. All right. Well, it just so happens that, and I know we're not talking a lot about the Glow 3 today or the Glow product, but I will mention this. The Glow, the proprietary ingredient is AC11, and one of the things that does help is helps the skin stay a lot flexible and pliable. So just like I mentioned with the Live, how it lengthens the telomeres, AC11 also lengthens the telomeres. And so that is the key ingredient. That's the two things. I love the JIFU products because they all kind of feed off each other. And when we talk about the benefits of one product, we can apply that to the other products, and they all kind of work together. So the Glow product can make your skin, be healthy and young appearing for many years, well into your advanced stages. And like the Gen 3 and the Live product, it does have some similar properties that will help you stay young and healthy. All right. I think we covered most of the big things here. I'm looking at my notes. I think we covered most things. The final thing I will say about the Gen 3 before I wrap it up is that it does have, I talked about the berries and the fruits that are very important, but it also has vitamin C, niacin, that's a tough one, pantothenic acid, vitamin B6, biotin, vitamin B12, and zinc. You can see all those ingredients there. I just realized they're on your screen. I don't need to read them. But those are the additional products in the Gen 3, which can be very helpful. All right, I did a lot of talking, and I usually talk pretty fast, and I didn't slow down that much. So hopefully I didn't make it too hard for you, Serena. But you guys said you were keeping up, so I applaud you. That can't be easy to do. Let me
Yeah.
turn it over to
So
you for questions and answers.
okay, so yeah, thank you so much, Dr. Bill, for the well translated and well information for us. So before I get people to ask question, to answer your question on the first stage where you asked who is on the call today, in fact, we have close to about 75 to 80 people on the call, and
Excellent.
those are all from APAC, if I can see the name correctly. Those are the great leaders that we have, and these leaders are really into JIFU's product. So today's event, I believe they could have even well versed with the knowledge that you have embarked for all of us. So thank you so much, Dr. Bill, for that. So with that, I'm going to put this thing on the floor now. Any one of you got any questions so that we can ask Dr. Bill, right on, but I think she's writing in Thai, so I don't want to translate that. Hang on, that is all in Thai. Is anyone else can write in English, or maybe Lawan, are you there? Can you help to translate? I still receive in Thai. Anyone can write in English? Anyone out there? We have Malaysia, we have Indonesia, we have Thai, we have Malaysia, and even Singapore. Yes. Okay, Dr. Bill, some questions for you. Some collagen brand advise consumer to cut intake of caffeine when consuming collagen. Is this the same case for Gen 3, Dr. Bill?
I've heard that before about caffeine. Um, I I believe that to be pretty minimal effect. You see me drinking coffee, right? It's 8 o'clock. Well, 8 o'clock our time here in Utah when we started. I don't know if any of you have been to the United States, or how many of you have been to the United States, but I do encourage you all to visit the great state of Utah. You can go stay with David Boyle. He's got a big house and loves company. I'm just kidding. You'll have to ask him. But you can stay with me. But I do
Welcome,
hope to
welcome, welcome.
I hope to meet a lot of you, and I welcome, come visit us in Utah. It's a gorgeous state, and the people here are very friendly and beautiful people too. So we're really blessed to live in this beautiful place. Sorry, what was the question? I totally forgot now.
Okay, they was asking some collagen brand
Oh,
advise consumer
caffeine,
to cut
yes.
intake. Yeah.
So I was talking about my coffee and what time it was, and I love my coffee. Well, I'll never give up caffeine. First of all, caffeine has a lot of great properties for the body. And, I think if you drink 1 cup of coffee, too much caffeine is bad for you. But 1 cup of coffee, I believe, is actually good for you and more likely to have protective health benefits than not drinking coffee. And the studies have shown that. So having a little bit of caffeine in your system is okay. And I've heard, so as a toxicologist, I'm asked this question. So who are you going to ask about an interaction between a drug, caffeine, even like fruits and medications? Sometimes those have interactions as well. So I'm kind of an expert in this field. And well, not kind of, I am an expert in this field. And I've also been asked this question about caffeine and many different things. And I haven't looked up every one of them to look at, why are they saying this? What is the evidence of it? But I can tell you when I've looked it up in the past for different things, the effects are extremely minimal. it's really not, it's not so important. So here's what I would say is there may be some small interaction where caffeine and collagen may have maybe a negative effect, but that interaction is extremely minimal and I wouldn't worry about it. So if you want to drink caffeine and you want to have your collagen drink, it's okay. Now, if you're drinking multiple cups of coffee all day long, you know, that's not so good for you either for a variety of reasons. But I think if you're having caffeine in moderation, you know, a little bit, and you're doing your Gen 3, I don't think that's a big deal. I think the interaction and the effects are extremely minimal, and I think you're fine to go ahead and do that. If you enjoy coffee like I do, I'm not going to give it up. But I
Okay.
have heard that before, so you're not the only one, and people have asked me about that, but I just think it's fairly minimal.
Okay, good. So thank you so much for the question, Harry. Okay, the next question that I have is what is a highlight ingredient in Glow?
The AC11 is really the highlight ingredient. So that was developed by a famous stem cell doctor, and it's a you know it was discovered in the Amazon, an ingredient in the Amazon, and the main thing about it is that it does exactly what the live I told you the resveratrol does. It helps with the telomeres. It helps them not shorten, stay longer. And it also has some other, you know, properties that are very helpful. It can reverse sun damage. It decreases inflammation. It enhances collagen formation. It enhances elastin formation. We talked about collagen and elastin when we talked about the Gen 3 product. It even boosts immune function. So all these things are the properties of AC11. And so that's the active ingredient along with a lot of other, you know, moisturizers and other peptides and things that can help the skin. The AC11 along with that is really why it makes it such a special product. And I'm kind of excited to endorse it because it really falls right into my anti-aging field that I'm very involved with these days. So I would say the AC11 is the one to really focus on.
Okay, good. Thank you so much, Dr. Bill. I think we can take another 2 or 3 more questions because I think Dr. Bill does have some appointment later on. So a quick one, there is some question about can diabetes take Gen 3?
Yes,
Okay,
diabetics can take Gen 3 and it would be good for diabetics to take.
great. So that's a great answer. Can Gen 3 and Leaf consume at the same time, Dr. Bill?
Yep. If that's convenient for you to take them all at the same time, you absolutely can do it at the same time. You know, when it comes to different, like, in general, when you're talking about medications, and also when you're talking about things you take, let's say twice a day or 3 times a day, um, it doesn't always have to be 12 hours apart, you know, especially even when you take medications. A lot of times people get confused about that. What do you do if you miss a dose? Let's say you're supposed to take a pill twice a day, but you miss your evening dose. What do? Well, the next day or whenever you remember, you catch up on what you missed. A lot of people don't know that. So if you miss a pill, the next time you take a pill, just take the one you forgot to take and you catch up. You do that with all medications that you're on, okay? And so at a certain point, when you're taking medications, you stop getting peaks and valleys of that level of the medication being in the bloodstream. You kind of reach a steady state. So when it comes to doing things that you're supposed to do 2 times a day, if at a certain point you reach kind of a steady state, even if it's a supplement like the collagen, it's not a medication. So instead of getting peaks and valleys when you take your medication or your supplements, at a certain point when you've been on it for a while, a few days, we'll call it, different medications take longer to reach a steady state. It has to do with half-lives. I don't want to get too technical, but you do reach more, at first you might be going like this when you're taking a pill or using a product, but then eventually it's more like this. It's less of a big jump, okay? So then that, I'm just telling you this because this is kind of goes along with the person asked, can you take the two things at the same time? Absolutely you can. And let's say you're supposed to take Live, you plan on taking Live twice a day, or the Gen 3 twice a day, 3 times a day, whatever you're going to do. It doesn't have to be separated by 8 hours. It doesn't, you could do it, you could do one, you could take your Live or your collagen, and then let's say that you have a busy day and you want to get 2 or 3 doses in that day. Just take it 1 hour later. You don't have to spread it out by 12 hours. So keep that in mind whenever we're spreading out doses of things that we're taking, like supplements or medications. You know, maybe in the first couple days, it might be more important to space it out, but eventually it doesn't really matter, not going to be a big deal. Even if you took 2 of the Live at the exact same time, because you didn't have time to take one earlier. What did I tell you earlier? You catch up if you forget a dose. So hopefully that's helpful.
Okay, so yeah, there's a lot of question coming in, but you know what? I'm gonna whatever that we have here, we're gonna go for 1 or 2 more points. But for the rest of you, I already got your answer. I already got your question. Sorry, but if in case today we cannot get any question answered for you, just send it to my email. I'm going to send it to you now. You guys can just drop an email, then I can send it to Dr. Bill, and then from there we'll address that. Okay. So I'm going to answer 2 more questions I have on hand now.
And also, Simon, I put on
Yes.
the screen Dr. Bill's website,
Yeah.
utahstemcells.com. It's a great resource for talking about the stem cell research he does, the weight loss, the health benefits, everything.
Nice.
Yep.
Okay,
I
good.
encourage you all to come, and we'll get I'm going to put a lot. I've kind of been hampered lately, but that's all changing now. I have a lot of different good content that I will definitely upload or send over to JIFU, as well as be putting on my website and social media. So I'm going to try to, you know, give a lot of, from time to time, I will just send out things to either the JIFU app or the JIFU website, or to our, you know, Instagram, social media. Just look for it all through JIFU or my website, and we're going to throw a lot of more helpful information and
Nice.
interesting topics we'll discuss.
Good. Okay, so we're going to take one last question, okay? So this question asks, will heat lessen the effectiveness of collagen? If not, can you mix the collagen with hot beverage like hot chocolate and warm milk, etc.? I believe that's for Gen 3, right?
Yeah, so it should be stable under heat, so I don't see a problem with that if you wanted to warm it up. And with chocolate, like hot chocolate and things like that, that shouldn't be an issue. So the heat is fine. What was the other question? Or was it
Yeah,
that was the only question?
Yeah, they just asked you whether the heat lessen the effectiveness of the collagen.
I don't believe so. I think you can heat it up, and if it did, it would be minimal, so it would be okay to heat it up.
Okay, so I think I'm good. David, is there anything else that we can wrap it up before we let Dr. Bill plan ahead?
I'm looking forward to the next one, believe me.
Yeah, so
Yes.
I like to vouch for that because I met him in Salt Lake City over dinner with the executive staff. I can tell you, Dr. Bill is such a nice, humble guy. And when you
Oh,
see
you
him
guys
in
are too
person,
nice to me.
you know, it's going to be like what they say in Chinese. You know, we're going to give you a bear hug. You know, it's a
I
very
love it.
nice, humble
Thank you.
doctor. Yeah.
Like
So
I
with that,
said, I love meeting people. I love forming
yes,
relationships. And so
yeah.
that's the best part of my job, is meeting people like you, Simon.
Yeah. Okay. So with that, I think just want to make sure that all of us you know, enjoy the event session with Dr. Bill, and I'm sure we will also invite Dr. Bill over to APAC one of these days with his schedule whenever he's allowed to. We'd love to have Dr. Bill back into Asia, and then yeah, let's have a good time with him when you see him in person. Okay. If not, for those who are traveling to Rome, I believe you're going to Rome, right? I believe, right, Dr. Bill? Are you going to
I'll
Rome?
be there. Yep.
See, that's it. So whoever wants to go to Rome, we will see them in person as well. So with that, thank you so much all. Dr. B, any last word from you?
For me, no, thank you very much for letting me participate. It's an honor. And I look forward and hopefully we'll be meeting in person, all of you.